Hey, if I can get my hand, my name is Allison Payne, and I will be doing my physical assessment checkoff. Okay. All right. Upon entering the room, I would identify myself. Hey, my name is Landry. I'm going to be your nurse today. And then I would identify the patient using two forms of identifiers, the patient's name, first and last, and their date of birth, compared to their hospital ID band and my charts, just to make sure there's no confusion with what patient I'll be assessing, making sure I have the correct patient. Then I will, of course, ensure patient privacy upon doing the physical assessment. Then I will perform hand hygiene and apply my gloves. I will wait for the antimicrobial Germ-X soap to dry fully before I apply my gloves. And throughout the video, I will tell you when I'm supposed to change my gloves, but I have one pair of gloves, so I will not be changing them every single time. But I do know that you are supposed to change them between each part of the body that you assess. So while I'm applying my gloves, I can go ahead and assess my patient's level of consciousness. Is she alert and oriented by asking her a series of questions such as, do you know where you are today? Do you know who the president is? Can you tell me what time it is? Things like that, just to make sure that she is alert and oriented. Okay, and as I'm, talking to the patient, asking that, I can go ahead and be assessing her from right off the bat. Checking her age, making sure it corresponds with what's on my chart. Does she look like she's supposed to be that age? Making sure I have the correct patient and that there is no abnormalities. Make sure that I have good lighting in the room that I'll be performing the assessment. Checking her skin tone, the color, is it appropriate for her race? Is it pale? Any abnormalities that could have bad outcomes, like decreased oxygen levels, problems with liver function, kidney function, anything like that. I can go ahead and be checking her facial features. She has a mask on right now, but I would be assessing those, making sure everything is symmetrical on both sides. If the patient is sitting in a chair or walking into the room, I can assess their gait, their balance, making sure that there's no leaning, make sure it's smooth, even, really just checking to make sure that there's no problem with their balance or with walking. If they're sitting, I can watch for leaning, any kind of giving on either side. Again, while they're sitting or standing up, I would be checking their posture, making sure that they have good posture, that they're up and erect, they're not slouched over. The patient could have scoliosis, so you want to be checking that, making sure there's no sign of that. Check their facial expressions, make sure that it is appropriate for what they came in for today, for the mood of the room. Make sure that they are dressed appropriately for the time of year, for the setting for which you don't want them in shorts and a t-shirt in the middle of July. And you're also making sure their hygiene, checking their fingernails, their hair, just making sure they look clean. Go ahead and assessing their appearance altogether. Then I would go ahead and check their vital signs and making sure that their height and weight corresponds with what I have on my chart, that there's no differences in that's kind of in the same range. Then I would go ahead and start assessing her skin. Like I said, upon initial seeing her, I can go ahead and be looking at exposed skin, seeing if there's any, looking at the color of it, seeing if there's any yellowing of the skin, is it bluish? Because like I said before, that can be a underlying problem with organs or oxygenation. I want to make sure that her skin tone is appropriate for her race, making sure that is she pale, is there areas of the skin that is different, just really checking that skin, making sure that there's no abnormalities. I would assess for rashes, edema, any kind of skin irritation, making sure that there's no scratches, cuts, bruises, anything that would be abnormal. With the back of my hand without a glove, like I said before, I I don't have enough gloves to remove and fix, but I do know without a glove, you would, with the back of your hand, check the temperature of her skin and feeling bilaterally of both arms or with the forehead, if that's just getting an extra check in, making sure that the temperature is not too high, not too hot, not too cold, you know, just kind of making sure it's a good temperature. Go ahead and check the capillary reflexes of her fingernails by, with your index and your thumb, mash the nail bed down and release and watch for it to refill for the capillary refills in under 3 seconds. If it's over 3 seconds, you are looking for dehydration for a possibility. And you want to do that to each one of the fingers. I do know that, but you want to check each capillary refill of the finger. Again, checking the skin, you know, is it dry, moist, really just getting an assessment of everything with the skin, making sure there's skin integrity, nothing perceiving to be wrong with it. You don't want pressure ulcers, red areas, any irritations, just really checking for abnormalities of the skin. You go ahead and check the skin turgor by pinching, again, you know, just with your thumb and your index finger. You're going to pinch right below her clavicle or on the forearm. You pinch and you want the skin to return instantly. You want it to drop right back down into its normal position. If it does not, that is also a sign of dehydration, and you would need to further assess that. You want to keep checking the skin, make sure there's no lumps, cuts, bruises, anything like that, just that the skin is intact and there's, again, no abnormalities. And if they don't have any lumps, bumps, bruises, anything like that, the skin is intact. This is a point where I would remove my gloves, perform hand hygiene, and apply new gloves. So then I would begin assessing the head. I would check the condition of her hair, you know, is it clean? The hygiene, you know, everything. If the patient was a male, then they would, and they had a facial hair, I would assess their beard. But just really check in, you know, to see, is it clean, well kept, that there's no balding, infestations, you know, lice, anything like that. And then you're going to palpate, just lightly press. You don't want to squeeze too hard. Be looking for any lesions, any masses, bumps, anything out of the ordinary. Making sure you check and get everything. Really assess that scalp and check for abnormalities. Okay, and then again, I would remove my gloves, perform hand hygiene, and apply new gloves. Okay, I'm going to move to the eyes next. I'm going to check the eyebrows, the eyelashes, eyes, make sure everything is symmetrical to her face. Checking the eyebrows and eyelashes for fullness, making sure they're present, that there's no missing, anything like that. And make sure everything looks clean and neat. Okay, and then I'm going to assess the pupils. Are they round, equal, reactive? You know, from side to side, are they round? Are they symmetrical? Are they the same size? For pupillary reflex, I would, in a hospital setting, I would dim the light. If I was to cut off this light, you would not be able to see me. So I'm not going to do that. But I do know to dim the light in a hospital setting, or to, you know, place a paper over the patient's face to yield the light. So I'm going to give a pen light, and I'm going to start from the side. Patient is looking forward, and I'm going to bring the light around into the line of view and watch for them to constrict, and again to the other side. Okay, and both of her pupils are equal, round, and reactive, and they did constrict together. While I'm assessing that, I can also be looking for at the sclera and the conjunctiva. The sclera is the white part of the eye. You don't want any yellowing, any irritations, anything like that. Yellowing can be, you know, liver failure or just any causes with the liver. Just really checking that that is that it's healthy. The excuse me, it's very hard to breathe in this mask. The conjunctiva, the corner of the eye, you don't want any crustiness, any just dirty, anything like that. You want to make sure that it's well kept and healthy. For the accommodations, I'm going to, again, get my Penlight, get back out, and bring an object slowly into view and see that the eyeballs, that the pupils, excuse me, constrict together when the patient sees the object. In this case, it is my Penlight. So I'm going to have it here, and I'm going to watch her pupils as I bring it forward, and they should constrict, and they do, as I bring it forward. Okay, and they are equal, reactive. I'm going to go ahead and assess her vision. In a hospital setting, I would have like her read the newspaper, a board in the room, you know, assign something to really assess that vision. But in this case, I'm going to have her read my first and last name off of my name badge. So can you go ahead and do that for me right now?
Allison Payne.
Okay. And Allison Payne is correct. So she has good vision. She wasn't squinting, doing anything to struggle. I'm going to check the extraocular movements of by, again, getting my Penlight. And I'm going to do the 6 fields of gaze. We're going to start in the middle, and we're going to go up. She's going to follow the Penlight down. Okay, and diagonal. Diagonal again. Diagonal. And diagonal. Very good. She was able to follow the Penlight with her eyes, and without any troubles. She listened everywhere I went. There was no struggle. I would also ask if the patient wore glasses, contacts, or they had like any prosthesis, like a glass eye, anything like that, to put into charting to make sure that see that if they are wearing it during their care. Okay, and before moving to the ears, again, I would remove my gloves, perform hand hygiene, and apply new gloves. And so I'm going to move on to the ears. I'm going to start by just assessing really the shape and is there any redness, the skin color of it, is it the same skin tone as the rest of her body, you know, making sure they're aligned with the canthus of the eye. If they're lower in younger patients, it can be a signal for a birth defect, such as Down syndrome. Anything like that, you want to check for tenderness by just kind of palpating very gently, you know, asking if there's any tenderness and noting if there is. To assess the ear, you are going to, in an adult, you're going to pull up and back very gently. You don't want any fast movements, pulling, yanking on the ear. You want to just very gently pull up and back. And on an infant or a younger small child, you would pull the ear back and down, again, in swift, gentle motions. Again, make sure they're not tender, just kind of really making sure that there's no abnormalities. I'm going to go ahead and assess her hearing with a whisper test. Before performing the whisper test, if the patient has hearing aids or any kind of a aid to help them with their hearing, you want to go ahead and ask them to remove that before performing the whisper test. So I'm going to do that by turning around, by hiding my face and whispering something, and then asking her to repeat it back to me. Okay? Okay, can you repeat that back to me?
1, 2, 3.
Very good. Okay, so she heard me. She has, she seems to be good with the hearing. With that, you want to make sure that they can't see your lips. That's why you cover your face, make sure everything's good. Then before moving to the nose, again, I would remove my gloves, perform hand hygiene, and apply new gloves. So with the nose, I'm going to go ahead and remove her face mask to assess her facial features. For the nose, you want to make sure it's symmetrical with the face. Ask the patient if they have broken their nose before or had any kind of traumatic experience to the nose or like surgery, anything like that. You want to make sure you really assess and get all the information from the patient. You want to check their smell. Normally use something minty or something with a strong odor to make sure that they don't have any problems smelling. Inspect the septum and the mucosa. I'm going to do that with my pen light. You're going to ask the patient to look up, and I'm going to take my pen light and shine it up each nostril, checking the septum and mucosa for making sure that's pink and moist and really just looks like healthy tissue. Then you would ask the patient to close one nostril at a time, get them to breathe out of both nostrils to make sure that there is no constrictions doing that. So I'm going to ask you to do that at this time. Okay? Very good. She was able to do that without any problems. So her septum, mucosa, nostrils, they are clear and very good. I'm going to go ahead and assess her sinuses, the frontal, ethmoid, and maxillary. For the frontal, I'm going to be using my thumbs, and it's her right above her eyebrows. So I'm going to go ahead and be checking for any masses, any kind of just abnormalities in the skin, bumps, anything like that. For the ethmoid, I'm going to use my 2 fingers on the nose. I'm just going to, again, be checking for any masses, anything like that. No, you don't want to find any abnormalities. And then, again, I'm going to use my thumbs for the maxillary. And, all right. And you're checking it, like I said, for masses, any kind of bumps, tenderness. You want to make sure that it's not tender. Then I'm going to change my gloves and perform hand hygiene and, put new gloves on before moving to her mouth. So for her mouth, I'm going to assess the lips. Are they symmetrical, smooth, shiny? Really just making sure that they're healthy. Hers look good. You don't want any kind of bluing around the mouth. And that is a sign of like lack of oxygen, anything like that. I'm going to be mask and shield. I'm going to use my pen light to assess her teeth, checking for hygiene. Does she have dentures or are they real teeth? Really assessing the gums. Are they in good shape? So I'm going to go ahead and do that now. Say, really looking at her teeth, making sure everything's good. And gums. Are they, no signs of gingivitis, any plaque on the teeth, just making sure that they're in good health, good hygiene. And then I'm going to use a tongue depressor on the inside of the mouth, checking for the tongue color, texture, size, while also assessing the pharynx, tonsils, hard and soft palate, taste. For taste, you would, if the patient had lunch, go ahead and ask them what they had and what it tasted like, kind of match them up, make sure that their sense of taste is intact. So I'm going to go ahead and look in her mouth, say eye for me, checking the hard palate, soft palate, tongue color, texture, pharynx, making sure that everything is good and it looks good. It's good in color, good texture. Everything looks normal. So I'm going to go ahead and change my gloves. Once again, I'm going to take these off, perform hand hygiene, and apply new gloves. Then I'm going to assess the neck. I'm going to, with a C motion, I don't know if you can see it, C motion, I'm going to check the midline, make sure the trachea is midline by just grabbing, gently just checking that it is symmetrical, midline, not moving. It's all the way up midline. Then I'm going to palpate and inspect the thyroid. There for tenderness, bumps, anything like that. You don't want to feel any of those, and if you do, of course, note it, chart it, and make sure. Okay, so I'm going to go ahead and palpate for any kind of abnormalities. Okay, she seems good. Excuse me, it's very difficult. Breathe in this mask. Okay, then I'm going to palpate the carotid artery using 2 fingers. You want to do both sides, but never the same side at once. So I'm going to start with this side and just check. Okay, and then I'm going to check this side. All right, nice and good. And you're going to assess the carotid flow by having the patient hold their breath and listening with the bell, the small part of the stethoscope. And I'm going to put them in my ears with the earpieces facing towards my nose. All right, and again, assessing with the bell. And you want to listen again, one side, then the other, making sure not to restrict the other side while you're listening. Okay, so we're going to go ahead and listen. All right, and listen. All right, and she sounds good. So then I'm going to palpate the lymph nodes using small circular motions. You don't want any, there shouldn't be any tenderness, they shouldn't be enlarged, no swelling, edema, anything like that. So I'm going to go ahead and palpate those, making sure, there's no tenderness with the patient on any of these, small circular motions. Okay. And then I will assess if there is any jugular distinctions. You don't want any swelling of the neck, bulging, anything like that, just making sure that there's no abnormalities to the jugular. Okay, and I'm going to replace her face mask. All right. Okay, and I'm going to remove my gloves, perform hand hygiene, and apply new gloves. Now I'm going to move to the chest and lungs. You would only expose the part of the chest or breast area that you are inspecting to ensure patient privacy. You will need to explain to the patient what part of the body you will be exposing and what you will be assessing. Assess, the chest for shape and symmetry. Assess the patient breathing. Are they breathing heavy? Are they breathing too slow? Is it, quick paced? Anything like that. Just really paying attention to their breathing. You're going to go ahead and palpate for tenderness with the pads of your fingers in soft circular motions. So you're just going to palpate, again, looking for any masses, any kind of abnormalities on the skin of the chest. Okay. Small circular motions. Just really assessing and palpating that chest area. For a female patient to do a breast exam, you will thoroughly explain to the patient what you're doing and how she can do it at home, making sure she understands what you're doing and how she can perform it at home. You want to start by putting her hand above her head to really access the area, divided into 4 quadrants. You're going to do inner upper, inner lower, outer upper, outer lower, palpating each region, checking for any bumps, any abnormalities, anything that doesn't feel right, and explain to the patient what will feel right and what wouldn't, making sure that there is no freak outs when she performs it at home, making sure she understands what she's doing and what is most important that she get done. Okay, before you're going to percuss on the chest, where you're going to listen and auscultate. Before you do it, to percuss, you're going to lay the first joint of the fingers onto the skin where you're going to listen to with the stethoscope, and you're going to tap it. You want to do this so there's changes in sound. You don't want it to affect anything, any masses. It helps you kind of get a really good listen to the chest sounds. So I'm going to go ahead and percuss, where I'm going to listen. Just kind of barely, tapping, really getting those sounds moving. Then I'm going to auscultate the diaphragm with the stethoscope, again with the earpieces pointing towards my nose. And I'm going to listen to with the diaphragm where I just percussed. Take a deep breath, good. All right, And you're gonna make sure you're listening to the appropriate places. And in a full physical exam in a hospital setting on a real patient, you would make sure to do side to side, down, across, and make sure you're doing it on the front 8 to 10 times, listening in each place. Then you're going to get the patient to lean up and to a sitting position and repeat the steps to the back of her back, avoiding scapula area because you can't listen through the bone. Again, percussing before, and on the back region, you want to make sure you listen 10 to 12 times. And just make sure you're getting really good listens, that she's taking deep, full breaths. All right, and I'm going to go ahead and change my gloves and perform hand hygiene, and put new gloves on, and start assessing the heart. I'm going to listen to the aortic, the pulmonic, Erb's point, tricuspid, and mitral. You're going to locate the specific spots, and you're going to first, inspect the region, while you're getting everything ready. Get your stethoscope. You're going to be inspecting the region for, lesions, visual pulsations, anything abnormal. You're going to find where you're going to listen. And I'm going to, for the aortic, it's on the right side of the chest. So we're going to start over here and move, listen. Then move to the pulmonic. Move your necklace. All right, and then down to Erb's point. It's in the middle of pulmonic and tricuspid. And tricuspid, I'm going to go ahead and explain that with a female patient, if for breast sounds, you are going to, with the back of your hand, lift the breast to make sure you get accurate readings on those. So for, you would do the Erb's point, tricuspid, and then mitral is in line with the nipple and the clavicle. And you want to listen to the mitral. I'm cold. I'm hung. I'm so sorry. The mitral for a whole minute in a real hospital setting, I would of course do that, and I do know to do that, but for the sake of time, I am just going to tell you that you would listen to the mitral for a full minute to make sure you get adequate listening. Then you're going to repeat those steps with the bell, the other side, the smaller part of your, again with the earpieces toward my face. And you're gonna listen with the bell, the smaller part of the, and you're listening for any murmurs, anything. The bell is more precise, so you can hear smaller, more precise sounds. So we're going to listen exactly where we just listened with the bell. We're going to listen to aortic, pulmonic, Erb's point, tricuspid, and again the mitral. And again, you would listen to the mitral for a full minute, making sure you get good listening. And for, of course, use the back of your hand anytime you do that. If the patient has a heart disease or anything like that, then this sound when you're listening, it's going to be kind of muffled or distanced in a way. So to improve that, you can have the patient lay in side laying position or SIMS to get the heart closer to the chest wall to get a better listen, to make sure you can really hear those cardiac sounds. Okay, then we are going to talk about the The love of the heart is S1, and that's the closure of your mitral and tricuspid valve. And then the second heart sound you hear is S2, and that's like the dub of the heart. The closure of the aortic and the pulmonic valve. And then we're going to move on to abdomen. And before doing that, of course, I would take my gloves off, perform hand hygiene, and apply new gloves. So for the abdomen, I'm going to only expose from the symphysis bone, pubis bone to the bottom of the sternum bone, divided into 4 quadrants: right up, right lower, right upper, left upper, and left lower. And I'm going to do this a little differently. You're going to inspect, auscultate, percuss, then palpate. You don't want to palpate before percussing or auscultating because you don't want to disrupt the bowel sounds. You want to hear the patient's natural bowel sound. You want to make sure the patient has voided, use the restroom before inspecting the abdomen. Make sure they're in a comfortable position for the abdominal assessment. Note that make sure the abdomen is symmetrical. You know, look across it and make sure, assess if it's flat or if it's obese. Just note anything that you see that is abnormal. Check the skin color. Does it match everywhere else that you've already assessed? Are there any stretch marks, scarring, venous patterns, anything abnormal? Assess for herniations, you know, raised parts in the skin, the umbilicus, anything really that you see out of the ordinary. Ask the patient if they've had any surgeries or anything, if this is the reason that they came in. Just really checking and inspecting that abdomen. Then you want to listen to and auscultate each quadrant. Make sure you're listening to each quadrant for 5 minutes. Before you say that you don't hear any sounds, make sure you want to give them a good listen. Listen to any pulsations from aortic region to the abdomen, going down into the abdomen. That's mostly found in elderly patients. You want to percuss each quadrant to check for masses, any kind of bumps, anything. Then you want to palpate each region, again checking for masses, any kind of abnormalities of the abdomen. You're going to locate the femoral pulses. I'm not going to show you that on my patient, but I will. It's right here on your groin area. Just make sure you get, make sure they're strong pulses and they're equal on each side. You're going to locate all the other pulses, the radial, which is here. All right, and you're going to assess both of those, making sure again that they're equal, beating in the same rhythm. Brachial, which is in the elbow, again assessing both of them, making sure that they're equal, beating about the same. Carotid, do not assess the same at both sides at the same time. So you want to do one and then assess the other. Again, making sure they're equal. And then you want to do the popliteal by removing, keeping patient covered except for what you're assessing. It's behind the knee. Make sure that's good, and then go ahead and check the other side, making sure that that one is strong just as well and equal. The dorsalis pedis behind the ankle. It's going to be right here. Make sure you feel, and then, okay, they're good. And then the pedal, you want to check the tops of the foot, checking that they're the same. And while I'm down here, I can go ahead and check her capillary refills on her toes, making sure that they are refilling with under 3 seconds. Just go ahead and get those pulses, make sure everything's equal. I'm going to change my gloves, perform hand hygiene, put new gloves on before moving to the musculoskeletal. I'm going to go ahead and assess the joints, her range of motion, check my chart, make sure that nowhere needs any kind of exercising, make sure everything's moving, assess for redness or warmth, for just again making sure everything is normal. For muscle strength, I'm going to use my 2 fingers. I'm going to ask you to squeeze those. All right, good grip, strong muscles. So for sensation and sensory, we're going to go ahead and assess those in a hospital, setting. I would prick the patient with something kind of pointy, making sure they can feel it. Ask them to close their eyes, touch them, then tell them, show me where I touched you. Check their balance and their gait, which I would have done earlier. And then make sure they move their arms well. Do the Romberg test where they stand with their feet together, arms out, make sure there's no swaying, any kind of abnormal movement. Instruct the patient to do a knee bend, and while doing that, I would check their reflexes in the arm. I would, of course, I would have a tool in a hospital setting. You would just hit it and watch that reflex. And the same with the knee. You'd hit right here on the knee, making sure that reflex is strong. The brachial is the arm and patella is the knee. Then I would assess the perineal area, provide privacy, of course, and make sure that they have emptied their bladder before you assess. Check the size, symmetry, making sure no lesions, edema, no tenderness in the testicular or vaginal area. If a male is uncircumcised, then you will retract the foreskin for the exam. Rectal exam, a female will be in side laying position, check for any hemorrhoids, anything abnormal. Male should be standing up, bending over with his hips flexed, inspect for rashes, lesions, hemorrhoids, anything like that. Then we're going to go and finish up with the cranial nerves. Cranial nerves, one is olfactory. That is the scent of smell, which we would have done earlier with that with the test. And then 2 is the optic, seeing if they can read. She read my badge. Ocular motor, and that is the 6 fields of gauge. The trochlear is the testing the eyes, making sure the pupils constrict. Trigeminal is the corneal reflex, touching the patient's corneal with a cotton ball, Q-tip, anything to get the patient to blink. Abductions is side-to-side gaze, which we did earlier. Facial muscle, ask the patient to, smile, raise her eyebrows, frown, anything with the facial muscles. Auditory is, of course, hearing. I did that with the whisper test. Glossopharyngeal is the taste. Vagus is, are they hoarse? Is their voice scratchy? Anything like that, just assessing their voice. Making sure that everything is good there. Number 11 is the spinal accessory, shrugging the shoulders and turning the head with resistance, making sure that there's no problems there. And lastly, the hypoglycemic is you would ask the patient to stick out their tongue and move it side to side, making sure that, again, there's no abnormalities there. Thank you.